Good morning, everyone. Thank you for joining us today for Day 2 of the 2022 National Minority Quality Forum Health Leadership Summit and Spring Health Braintrust. I'm so glad to be here with you in person and that we're able to safely gather together once again this year. By the way, I'm Congresswoman Robin Kelly from the 2nd Congressional District of Illinois and the chair of the Congressional Black Caucus Health Braintrust. As we navigate our way out of the height of the COVID-19 pandemic, this year's Mind Over Matter theme is so fitting. I am sure that, like me, many of you have spent the past 2 years focusing on how to improve our public health and eliminate health inequities so that we're better prepared for the next crisis. Many of you have been coming to these summits for years, and I know that everyone here has a long-standing vested stake in health equity. During the COVID-19 pandemic, the rest of the country was exposed to some of the health inequities and disparities that we have all known about and been fighting for years. The exciting news is that more people than ever understand the urgency of addressing these decades-old health inequities, and that the National Minority Quality Forum and all of the fantastic partners and organizations here today stand ready and prepared to take action. So as you are listening and collaborating today, I urge you to keep thinking about how you can take back what you learned today to your organizations and your communities to continue fighting systemic health injustices. We have a lot of interesting panels and discussions today. We'll be talking about mental health, the maternal mortality crisis, access to care, new models of care, diabetes, and the role that the health industry can play in eliminating inequities. And of course, tonight, we will recognize the recipients of our 40 Under 40 Leadership Awards and our Lifetime Achievement Award. I am looking forward to our conversations today, and I'm so glad that you could be here to focus on strengthening America's health system for everyone. I will now hand things over to Dr. Rachel, President of the National Medical Association. Thank you.
So I'm going to pull the mic down for the short person level. Good morning, everyone. I'd really like to thank Dr. Puckering and Congresswoman Kelly, not only for the invitation to participate, but for their commitment to diversity, equity, and the health of our communities long before it became popular or easy, and for understanding the need and the importance of bringing us together in forums like this today. As you know, or maybe some of you don't know, the NMA represents Black physicians and patients across the country. And when we were founded in 1895, we weren't allowed to be part of majority organizations or obtain privileges in hospitals. And because for African Americans at that time, separate did not mean equal, and it meant substandard care. So we organized ourselves. We created our own hospitals, we created our own medical schools, and we took care of our own patients and made sure they had quality care. And so long before diversity, equity, and inclusion became popular catchphrases of the day, NMA was firmly rooted at the intersection of health, equity, and social justice. It's woven into our fabric. It's the foundation on which our organization is built. It's our backbone, and it really is who we are then and who we are now. And while as president, I've had the privilege of representing NMA in really amazing forums. None is more important than when we come together in this forum at NMQF. We provide a critical lens and voice to the most pressing issues for our communities and for those communities that don't have a voice. It's in this room, it's with the thoughtful conversations that we've had, like we had last evening. I think it was a really powerful conversation that we challenge the status quo and we'll change culture, because we have to hold our healthcare systems, our training systems accountable, and we have to hold ourselves accountable accountable to change those structural and systemic inequities that provide barriers to our communities for having optimal care. We know the solutions and conversations are complex, and we know that identifying racism and bias in our healthcare system as drivers of disparities is uncomfortable but necessary, and we continue to need to really name racism as one of the root causes of the disparities that exist in our healthcare system today. It's critically important that we continue to come together as a collective of physicians, health professionals, policy experts, and advocates to educate our communities, develop policies and concrete actionable steps with metrics to evaluate them. We must be intentional about our work and utilize the power of all of us here today, NMA, NMQF, AMA, NHMA. We need to continue to join forces to change the health of our communities. Last evening, Dr. Puckering and I pledged that we'd really work together to improve communication between NMA and NMQF. Our missions are so naturally aligned. If the pandemic taught us nothing else, that we are really stronger together. And I know that's somebody's catchphrase. It might be New York, because that's where I'm from, so please don't quote me on that. But it's somebody's slogan, I forget, but it's true. There's so much work for us to get done. Our communities are suffering, our infrastructure crumbling, mothers are dying disproportionately of preventable deaths. The pandemic exacerbated our already very fragile healthcare system for our communities and for the underserved. We can't let our foot off the gas pedal.
Yeah, you gotta come in. I haven't touched anything. Organizations and institutions that have discussed last week, issues surrounding health equity and health inequity. coverage.
Equity, diversity, inclusion, and belonging. Just imagine what it could be and feel like if we collectively created a robust healthcare workforce pipeline to increase diversity in clinical trials, improved innovations, and access to equitable and quality healthcare, and advanced policies and institutional initiatives that eliminate educational and economic disparities, and also to protect Medicare and Medicaid for future generations. I will end by encouraging all in this room to work with the Association of Black Cardiologists, National Minority Quality Forum, Congressional Black Caucus, American Medical Association, National Medical Association, National Hispanic Medical Association, and Black Women's Health Imperative, and other organizations and institutions in our everyday efforts to save lives. Let us travel the miles ahead together toward reaching our goal of achieving optimal healthcare outcomes for all peoples. For more information about the Association of Black Cardiologists, please visit www.abcardio.org. Thank you, and enjoy today's conference and evening events.
It's an honor to be here today. I'm Dr. Elena Rios. I just flew in last night from Los Angeles. I actually got to celebrate my birthday this year at home in Whittier, California, with some of my closest high school friends and family. I just wanted to say, on behalf of the board of directors, I know Judy Flores is here. Oh, Judy, you're here. Judy Flores is here representing us this weekend with the AMA and with NMQF. I think from the National Hispanic Medical Association and our foundation, I want to tell you two things. One is the NHMA has always been an advocacy organization. We were started in 1994, unlike the NMA, we haven't had the 100 years celebration, but we just had our 25th annual conference, and it was a mind blower for us because so many of the young people came out, and we've seen the generation change in our organization for the first time. When we started our organization, many of the medical students are now mid-career doctors. And what's great is to see the family grow, the NHMA having a council of residents, council of young physicians, and also we started specialty councils this year. And we're very pleased to see the connections and the importance because of the network, because as our speakers were just talking about all the issues of discrimination and racism in our country, that it really takes all of us to work together to solve the problems and to be part of the design and planning and implementation of the research needed to be able to change what will become a minority country. We are seeing the browning of America, and within the next 20 years, by 2035, 2042, if you look at the census projections, the Hispanics will be 1 out of 4 Americans. And for the African American and the Asians and all of the other minority groups, I don't even know what our minority groups are going to call themselves, but we are the emerging majority. And I think what's important is that we build our networks and that we build the youth of the future with our organizations, and we continue to grow closer to our medical students and pre-med students and pre-health students. So from the NHMA perspective, we have developed individual training, mentoring one-on-one with our College Health Scholars Program and with our NHMA Leadership Fellowship, and we're starting our NHMA Resident Leadership Program to develop advocacy and the importance of public health among our physicians. On the foundation side, we have NHMA started its own foundation in 1994. We changed the name from medical to health, and we call it the National Hispanic Health Foundation. That foundation has developed a scholarship since 2004, giving over a couple $1 million to over 400 students. And we've decided to partner with our sister organizations, the Latino Caucus of the American Public Health Association, the Hispanic nurses, the Hispanic dentists. We even started a Hispanic pharmacist group. And we give scholarships to all of these different students, and again, so that we can bring them into our family. And I think this is the power of what we're all doing in our organizations here today. The other thing with our foundation, I just have to say this is our future, is we're starting our National Center for Hispanic Health Research. And today I'm speaking actually with the National Academies of Medicine about the future of environmental health research and the importance of building our own researchers and our own principal investigators within our clinical trials for private practice, and also our academic researchers. We want to be able to mentor senior researchers with junior researchers through our Center for Hispanic Health Research. And this will become the future for our organizations. And then lastly, I'll just say, we've been working with NMA and AMA and the ABC organization for many, many years. And I think it's important that we continue to build our strength in numbers by working together. And with NMQF, I want to say, Gary, thank you for having me here again. Just want to say that we've started a new coalition called the Coalition for for Health Equity for Chronic Diseases, and with NMQF and with the Black Women's Health Imperative. And we're looking forward to tackling obesity in the first year of this coalition. It's just important that we also have to announce that we just started our Alliance for Multicultural Physicians. We finally have a 501c3 National Council of Physicians, NMA, and also with the Association of American Physicians. So thank you very much and have a great conference. And I just want to say, one last thing I just have to say to Congresswoman Kelly. Being introduced, so thank you very much for that.